Let's go ahead and set the stage for you because this is a very big issue for millions of Americans across our country. Biggest news that came out yesterday in Washington, D.C., with the Senate failing to pass either of those two competing bills that would address the issue of those expiring healthcare tax credits under the Affordable Care Act. Okay, now we're looking at a possible spike in insurance premium hikes for millions of Americans. When we look at the difference between these two bills that did not make it through in the Senate yesterday, Democrats have been consistent in saying that they want to give just a 3-year extension to the current subsidies, while Republicans say they want to get rid of those extensions, and instead they want to try to put money into health savings accounts that they say will help pay for people's premiums, at least some people who are using and currently under the ACA. But we've been looking at research from KFF. It's an independent source for healthcare policy and research. It says 22 million people could see an average of 114% spikes on their premiums come January 1st if something is not done with the expiration of these subsidies. Again, that is set to take place December 31st. And right now, joining us live this morning, we have Matthew McGaugh, who is a policy expert with KFF, specifically on this conversation of the ACA and the program and all of the impacts that these conversations could have. Matthew, thank you so much for joining us this morning. Appreciate your time. That December 15th is going to be the deadline for people to sign up. So a lot of people are currently watching what is happening in Washington, D.C. My first question to you is, which brackets, which people in terms of how much they're making, set the stage for us the impact that this could potentially have, and which groups kind of stand to be impacted the most?
Yeah, first off, thank you for having me. The reality is that the vast majority of people who receive health insurance through the Affordable Care Act exchanges receive some form of premium tax credit that lowers the amount that they pay on a monthly basis, and then thus are going to be impacted pretty severely by the expiration of these enhanced tax credits, seeing how much they pay on a monthly basis increase by 114% on average, or $1,000 a year. There's huge variation in this number. People who are younger and maybe lower income could potentially see how much they pay on a monthly basis increase only a few dollars. However, this is a group that has very volatile incomes year to year, and a few dollars can have a massive impact on their household budgets. People who are older and maybe making who are more middle class or making upwards of 400% of the federal poverty line, which is about $63,000 for an individual in 2025. Those people could stand to see how much they pay on a yearly basis increase well over $10,000 in some states, close to $20,000. States that have historically high premiums in their health insurance markets. Think West Virginia, Wyoming. So there's huge variation, but this is a group of people who historically don't get offered health insurance coverage from their employer or make too much money to be eligible for Medicaid. These are, small business owners, entrepreneurs, people who work for small businesses, people in the gig economy and are self-employed, farmers and ranchers are all typically part of the profile of people who receive insurance through the individual market. And these are people who definitely stand the most to lose if these enhanced tax credits do expire.
And Matthew, if I'm not mistaken, I think it's 24 million Americans currently use ACA Marketplace for the health insurance in some capacity. I know you all have done a lot of polling on where people stand with the, looming expiration of this. How do people feel about that according to you all's research? And, with inflation and everything, as you were just talking about, already hitting people's pocketbooks, what are people saying that they will do if it is to where the tax credits no longer exist? Will they continue with their health care?
Our recent polling shows that the Affordable Care Act, sort of among everyone nationwide, is the most popular that it's ever been. And looking, likewise at the enhanced premium tax credits, there is bipartisan support for an extension of these enhanced premium tax credits. Both Republican and Democrat constituents support an extension, a majority of both. Um, if you were to look at Affordable Care Act enrollees just themselves, the people who are going to be directly affected by the expiration of these enhanced tax credits, 84% of them say that they would like some extension of these enhanced tax credits. These enrollees are very sensitive to any changes in the price that they pay for insurance. 6 in 10 of them say that they could not handle just a $300 increase annually in what they pay on um, an annual basis towards their premiums. And significant shares of them say that they would consider going down to a lower tier plan, a plan that is less generous, or becoming uninsured if the amount that they pay on a monthly basis increases.
And I want to kind of pick something out of what you just said there, because I think when people kind of hear the discussion that's going on in Washington, D.C., it almost, to some, you can kind of get lost and think that it's only Democrats who want to extend the tax credits in terms of like Democratic supporters. But there is like a bipartisan push right now. I know in the House, even with our Congresswoman, Jen Kiggans, who's a Republican out of Virginia Beach, who's presented a plan alongside with a Democrat to extend the tax credits for at least 2 years with some modifications. What are Democrats and Republicans who have been polled by you all saying in terms of their support for the extension? Are you seeing it pretty much bipartisan in that?
Yes, nationwide there is bipartisan support for an extension of these enhanced tax credits. The enhanced tax credits have expanded the Affordable Care Act marketplaces. Before the COVID-19 pandemic, when these were instated, there was about 11 or 12 million people on the Affordable Care Act marketplaces. In 2025, that's over doubled to 24.3 million people. And this has mainly been driven by southern red states that have not expanded Medicaid and had high uninsured rates prior to the COVID-19 pandemic. So Florida, Texas, the Carolinas, Georgia have all seen almost a tripling or over tripling in their marketplace population, such that some Republican congressmen now have, between a quarter and a third of their total constituents that are enrolled in Affordable Care Act marketplace plans. So that's really sort of what's behind the scenes, potentially driving some GOP lawmakers to now support an extension and whatever it looks like, just an extension period in the Affordable Care Act enhanced subsidies.
You all also looked in some of your most recent data about how people feel about our nation's leaders, particularly around this topic. So, obviously, the tax credits were pretty much the dividing line that led to our record-breaking government shutdown. That we ended it without any real resolution, just a promise that we'd vote, and then yesterday we voted, and there was no resolution. Based upon you all's research, what are people saying in terms of who they trust more or who they blame more for the circumstances that we're in if this were to be something that would cost them more money in order to be insured?
It's clear from polling research, both from ours and other institutes, that Democrats are more trusted on healthcare than Republicans. And additionally, the aftermath of the government shutdown is that Democrats came out on top and are were less to blame for the government shutdown in terms of public opinion.
I find that so interesting, especially when you think about it. Still, there wasn't a resolution that was kind of reached, but to see those and hear that in you all's research was interesting to me. We have the, conversation. People are asking for an extension based upon the research here, but if there was any kind of bipartisan approach, I don't know if this is in you guys' research. Are you guys getting maybe did you ask voters and polls what they would consider like a picture perfect scenario, maybe a best of both worlds? Are you getting kind of insight on what would work for both sides in this conversation?
While our polling didn't ask on different policy proposals that have been introduced from both sides over the last few years, what we do know is that this group is very sensitive to changes in what they pay for their health insurance on a monthly basis. we've seen in our research that this group is not able to tolerate, or many of them, 6 in 10, are not able to tolerate just a $300 increase in what they pay for their health insurance premiums. And a quarter of them would consider being uninsured if these enhanced tax credits do expire. So, while we didn't ask about any specific policy proposals that have risen up in the last few weeks or few months, we do know that any changes to this original structure of the enhanced premium tax credits could potentially drive people to purchase lower value plans on the Affordable Care Act marketplace or just decide to become uninsured.
And Matt, I just want to ask you if there's anything that I have not currently asked as a part of your research that you think for our viewers and people who are watching this right now on the stream, that you think is really a pivotal point and something that you all discovered in the process of looking into the situation.
Yeah, I think the reality is that most people who receive coverage through the Affordable Care Act, the vast majority, in fact, are going to have no good option when it comes to purchasing health insurance through the ACA marketplaces next year. You should always talk to your healthcare navigator if you use one, agent, broker, other sort of consultant that you can go to talk about purchasing health insurance on the marketplaces. If you are buying a plan that is, silver or gold, you can consider dropping down to a bronze tier plan, which is going to have a lower monthly premium. But the flip side is that you'll have a higher deductible, thousands of dollars more, in fact, on average $7,000 for deductible for a bronze plan this year. Um, so people are really going to have to weigh their own personal preferences and their own healthcare decisions and see if they can assume the risk of having a lower value plan, if they can assume the risk of becoming uninsured. But the reality is that much of this population of 24 million people who receive Affordable Care Act coverage, and the vast majority of them who receive subsidies, are going to be left with no good option next year. And this is not necessarily a topic that is exclusive or affects just this population. If more people are uninsured, that means that when they have a medical event, they're going to receive medical care that is going to be uncompensated at a hospital location. And that drives up prices for everyone across who has any different type of insurance, who has insurance through their employer, Medicare, Medicaid. So this is just, one more reason why the US has higher healthcare prices than any other country in the world.
Well, Matthew McGaw with KFF, policy expert, particularly on ACA. And, I think no matter where you stand on this, we're seeing, again, that bipartisan approach, even from our lawmakers that know that this does stand to be an issue come December 31st with everything set to go into effect January 1st. We appreciate you, Matt, for joining us here on the stream. We're going to have to welcome you back at some point if you can give you your time, especially as we get closer to that deadline.
Yep, absolutely. Thank you for having me.
All right, sir. Appreciate you. Happy holidays. Okay, and so we actually have been getting and pulling reaction from lawmakers as well, including those who represent us here in Virginia. For those of you who are watching maybe through the stream, you're not in Virginia. That's where we are based here at 13 News Now, here at our live Impact News studio. And we were able to hear from Senator Mark Warner, a Democrat out of Virginia, after, I do believe, the ACA, this vote did not go through there in the Senate for the extensions. Let's listen to what he has to say in response.
I've just voted on the Republican plan. It candidly is a joke. It would have added $1,500 to a health savings account. $1,500 once a year doesn't even meet the increase. I had one of my a Virginian come up and testify yesterday, and we can make the videotape available. Kathleen, who lives down in Newport News, she's got a business. Her husband's got a business. She pays about $544 a month now. When you see the price increase and you get rid of subsidies, her rates go up to $1,500 a month. She doesn't know if she's going to be able to keep her business. And the idea that a one-time chunk of dollars into a health savings account, when you also would give up all of the protections that the AC has on ACA has on pre-existing conditions, on what's called the lifetime cap. It would allow the insurance companies to even be more predatory. And it's not a serious issue, or not a serious proposal from the Republicans. I'm not even sure all the Republicans are going to vote for it. I'll be voting for the Democratic position this afternoon that would extend these premiums for 3 years, give us time for reforms. If there are ways to look at, for example, making sure there's not insurance fraud, count me in. But my Republican friends have drugged this out so long. Literally, Virginia families have to decide by December 15th what plan they're going to buy. And all the data indicates for the 24 million Americans who buy their insurance on the marketplace, about 4 or 5 million are going to go without health insurance. And what does that mean? Well, it means they're going to show up at the emergency room, which means that those of us who have health care coverage, the wait times are longer, but more importantly, the overall costs of our insurance is going to go up, because if you take this many people out of the risk pools, as they're called, and put them back in the emergency room, what's called uncompensated care, where the hospital has to eat the cost, what does that mean? Well, they simply are going to pass those costs on to folks with health insurance. It's a disaster. It is an avoidable cliff. You know, we could even do the extension for a shorter period of time and then look at reform. But this is one more example of where the president, who keeps saying everything's perfect and the economy is roaring and affordability is a hoax, I just hope folks remember, when housing costs don't go down and their health care rates go up, Donald Trump and his followers in Congress own this, because they've not been responsible at all at trying to prevent this cliff from happening. And it's not something you can punt on until next year. People's lives will be dramatically changed now. I mean, the number of folks who are going to have a dramatically different Christmas because they see their rates going up, as Kathleen and her husband, by over $1,000 a month. If there's going to be a Scrooge this year, his name is Donald J. Trump.
Strong words there from the Democratic senator out of Virginia, Mark Warner there. And then looking at those two votes from yesterday on the Senate vote list here, both were rejected by a count of 51 to 48. Now, a few days ago, prior to this vote taking place, we actually had on economic expert Bob McNabb. He was in our studio. We talked to him about the economic impact that this could have on people. We were also looking at the defense spending bill and what that could do. But we spent some time talking about the ACA tax credits, and then also just the history, too, behind healthcare here within the country. I thought his response and context was really helpful and insightful, so we're going to play that back. Again, this is Bob McNabb, economics professor from Old Dominion University, who was with us just a few days ago prior to this vote taking place.
Well, first of all, you can use data in different ways, right? The speaker can be correct, and the Kaiser Family Foundation that you just referenced could be correct. If I look at the amount of subsidies and I look at the total programmatic cost of insurance in the United States, or Obamacare, those subsidies would be a relatively small percentage. However, if I look at the average premium of people on the marketplace, who are a relatively small percentage of the overall health insurance marketplace in the United States, then those subsidies reduce costs significantly. So both are correct, it's just a different perspective. What I'm seeing in terms of the conversation, especially now that we have a draft bill from the Senate that you referenced is going to be voted on tomorrow, and what I suspect will be coming out of the House, is the Senate proposal and likely the House proposal will not be extending the Obamacare subsidies, but a replacement of those subsidies with high deductible plans and health savings accounts. And the problem is that what evidence we have in terms of what used to be called risk pooling, right? We want everybody in the health insurance pool because you have healthy people, you have sicker people, and that on average lowers premiums for the sick people, and maybe the healthiest people pay a little bit more, but you never know. If you're in your 20s, you get in an accident, all of a sudden you need health insurance, right? So that risk pooling approach is the way to lower that cost of health insurance for everybody. If you move to a model where you allow insurers to peel off the healthiest people, then they can insure those people for relatively low cost, and then you have people who have pre-existing conditions and other health conditions that are a higher cost, and they get stuck in high premium pools. We used to do that before the Affordable Care Act. The problem is we have short memories. People don't seem to remember the time where if you have pre-existing conditions, and I'm not talking cancer, I'm talking asthma, I'm talking, you had acne as a kid, right? You broke a leg. You had a car accident. That became a pre-existing condition and moved you out of that low risk pool to a medium or higher risk pool and changed your deductibles considerably. We have forgotten what that was like. Also, people have forgotten that pre-ACA, we had caps on insurance, that your policy might have been a great policy, but it only covered $1 million in lifetime medical expenses. You get a heart attack or cancer or something traumatic in your life, and all of a sudden you found middle of your hospital stay, you were uninsured and you couldn't pick up insurance anymore. So the devil is in the details, right? A high deductible plan coupled with a high health savings account sounds like it can save you money. But the question is, first, how much is the government subsidy flowing into those health savings accounts? Right now, the Senate bill is proposing $1,000 or $2,000 a year. That will nowhere make up for the increase in the marketplace premiums or the deductibles. Let's say they freeze premiums on the marketplace, and I give you $1,000, and all of a sudden your deductible is $7,000 or $10,000. The net doesn't work out. So that really is what's bedeviled a lot of the plans from the Republicans in the past, is that the financial realities of these high deductible accounts or health saving accounts just run up against the rising cost of health care in the United States.
Really appreciated that context and in-depth response there from Bob McNabb from Old Dominion University earlier this week. And again, as we've reported, that health savings account proposal by Republicans in the Senate did not pass. Neither did the 3-year extension by Democrats. Both failed to meet the 60 mark threshold. And so, again, that's a situation where we are counting down the days. It is now less than 3 weeks away from those credits expiring, and less than 3 days away from that December 15th deadline in which people sign up for the Affordable Care Act in the marketplace. And they will surely then be looking at what would likely be a massive increase in their premiums. And so, again, both sides are trying to figure out something. And we'll see if anything can potentially move or change here within the next 3 weeks. But right now, it does not appear as though that is going to happen, particularly if it did not take place after, again, the longest government shutdown in the history of our nation.